is a topic that this is a topic that most physicians and most clinicians do not know much about, including myself. I was an RN for 14 years before I came to Neomed, and I've been a hospitalist physician at Salem Regional for 14 years. And until somebody in my family became ill with Lyme, I really did not know how complex it is. Most of us know the basics. We see the ads on TV. We know prevention, and we know a tick. However, even that ad is a little misleading, and I'll go through all the reasons why. On this front screen, you're going to see what a spirochete looks like, and that's what causes Lyme disease. They're spiral shaped. They can form in plaques. On the bottom right, you can see a microscopic slide that shows just how tiny they are. Even when stained, and they're very hard to stain, they're very hard to find, they're really, really small. And since they're spiral shaped, they make their way out of the bloodstream really quickly, and it's hard to find them, to culture them. They grow very slowly like TB. So it is a disease that oftentimes are not diagnosed. I wanted to mention that I think that it's important too because it's so costly. $75 billion is what they estimate the indirect and direct costs of Lyme disease. And the reason is because people have symptoms, they go to their physician and they do tests, they're negative. And then they go to a specialist, they do tests that are negative. Meanwhile, the patient's getting worse. Then they're in the state where they might have to go to neurology. It ends up being most patients see at least 5 physicians before they get diagnosed.
Erie, just a quick, sorry to interrupt you, but
no, that's fine.
Slides are not advancing.
They're not advancing?
Correct.
Okay.
But going on to the next slide yet or not?
I don't know how to. I thought I just go sideways. Wait a minute. Maybe do I just, there we go.
There you go. Perfect.
Okay. So one of the, so after someone in my family got sick, I started investigating. And this is a person who was a breast cancer researcher. His name is Dr. Neil Spector. He had Lyme and had the same type of situation that most people do. He was diagnosed. He went to the Dream Team, which is who diagnosed some of the star basketball players, and they didn't diagnose him. So it's very easy to miss. And I brought up this slide so that you can see 2 of his online YouTubes. If you do nothing else from today, if you would listen to what he says on these YouTubes, you will learn so much. So on the first one, he talks about what happened to him and how he was told he had chronic fatigue syndrome, and it was stress. He had developed 2 breast cancer treatments for FDA approval, and they are in use now. And by the time he was diagnosed, his ejection fraction was 10%. He switched his research completely to Lyme, and he says that Lyme is in the dark ages on research. And this second video, if you get a chance to look at those when you have time, is of precision medicine. He was doing the same type of treatment for breast cancer that was successful for Lyme, and it made it all the way to they're going to be recruiting at UCSD within the next year. Unfortunately, it had a heart transplant because of the Lyme disease, and he passed away in 2020. But his team at Duke is still very active, and they're Hopkins, Tulane, and Duke are in the forefront of the Lyme treatment. Whoops, I'm sorry. I'm going to go to the next one. I'm not sure how to go to the next slide. I'm sorry, I haven't given a presentation in so long. Let me see if I can get this to stop.
It's okay. If you just go to the next slide, it'll stop.
How do I get to the next slide though? It's not moving. I'm going sideways. There we go. Sorry. Okay, so today's talk, I want to list 3 reasons why Lyme is so often misdiagnosed, compare Lyme and syphilis, because syphilis is the only other disease that's of significance that's caused by the spirochete. And I want to compare them for the reliability of the tests and treatment. Understand that Lyme and syphilis can both cause brain disorders. And then, since a lot of you are counselors, I wanted you to recall that acceptance and commitment therapy is much better for Lyme patients because cognitive behavior therapy would be trying to change their thinking, and it's not their thinking, it's a problem. So this is a spirochetes again showing the Lyme and syphilis. Lyme is 3 times more common. There's 500,000 cases, and that's what the CDC is estimating now. However, it's much higher than that because they only take a percentage of cases. I'll explain that in a minute. So whenever you're thinking of your patients, if they were not diagnosed with syphilis, you would know that they could have some pretty severe problems. But we don't really know that in medicine about Lyme disease. So those 2 are the main ones. Treponema is spirochetes that they're found in your mouth. Dental gum infections have treponema in those. And also the dental gum infections have other bacteria, and that becomes important later in some of the brain information that's coming out now. Leptospirosis and relapsing fever are common in other countries. In the United States, it's less than 200 patients a year. So when we concentrate sometimes on the more minor, it's not minor in the rest of the world. I mean, there's a lot of people in the rest of the world, but in our teaching, a lot of times, our Lyme teaching is equally divided, and you get 10 minutes for Lyme and 10 minutes for leptospirosis. And I really think that's misguided. We have to go with the main causes of diseases. Here's another picture of the spirochetes. On the left is the under slide. This makes them look really large, and they're really, really tiny. On the right, you can see how they're corkscrew shaped, and they go down into the tissues a lot easier than hardly any other kind of bacteria. They are very unique, and I can't emphasize that enough. So if you would compare Lyme and syphilis, syphilis tests are very sensitive. Lyme sensitivity, and this is per the CDC, is only 20 to 40% in the early and mid stages when the treatment is the most effective. Syphilis, you have skin lesions, so you would know. It would be hard to miss when your syphilis goes to the brain, because you would look like you see pictures sometimes from in Africa where they don't have it under control. But in Lyme, you look great. They actually look better than a lot of people. And that's really aggravating to Lyme patients. They say they feel so terrible, and everybody tells them how great they look. Syphilis has a Tuskegee, as most of you know about, where the prisoners were not treated for syphilis. And they think it was intentional, but I actually just wonder if it wasn't just our government not doing a very good job of following up on studies. I found that is the case. But anyway, they went to the brain. Lyme is going to the brain now. And the people are having trouble thinking, they're having trouble with school, they're having trouble being able to work, but they're called hypochondriacs. Syphilis occurs mostly in adults. Lyme occurs in all ages. Syphilis treatment is pretty good. You give penicillin. If you catch it, even in the mid stages, you give penicillin. Maybe it might give a couple more shots, but it works well. Lyme treatment, if it's past the first month or 2, it's really hard to treat. Syphilis occurs as a single disease, and Lyme often has co-infections. Now, this is from LymeDisease.org. It's an excellent website. It's the largest in the world, and it was started by I don't really know who it was started by. I shouldn't say that. The CEO is Lorraine Johnson, and she was told she had depression, and the medication didn't work, and she was on it for 4 years, and finally she found out she had Lyme disease. So she's the CEO of this, and they are so active in the government emphasis on it now. There's the Tick-Borne Task Force, LymeX, the KHIG and TICAC, and this group is really active on it. So they surveyed their database of patients. There's 16,000 contributed their information, so it's really big. And they said, why is it that your Lyme disease was not diagnosed early? Well, number 1 is no surprise, inadequate physician education. Number 2 is the false negative lab test. It's not only the false negative, it's also false. It's also positive, because a lot of physicians say it's a false positive. They won't treat. The poor patient is caught in the middle, and they don't get treatment. A lot of the patients don't see the rash. 1 in 3 didn't see it rash. Or they were thought to reside in a state that was considered to be low incidence. or the first disease manifestation, they didn't really notice, maybe they had fatigue, but all of a sudden then they have problems with thinking, or they have heart problems like Dr. Spector had. The public misinformation is huge. The patients are now getting organized enough to where I'm hoping they make a difference. But if you see the research, it's been since the 1970s, and it's time for them to really be heard. The Wall Street Journal actually had this article. It told that, I can't read the top of it, but there's very few cases reported to CDC, such as in California. They had 90 cases reported, but they had 46,000 claims that had Lyme diagnosed by the primary care person. Texas reported 31 to the CDC, but they had 31,000 that their PCP thought had Lyme. So it's now considered epidemic. And the 3 states that I've mentioned here with all these numbers that are off, they're considered low incidence. And that's important because the way CDC counts it, if you're in a high incidence state, they will count 1 out of 7 that the physician or primary care diagnosed. If you live in a low incidence state, they will only count 1 out of 50. So say you say, hey, I have 7,000 patients that I think as a primary care has Lyme. If you're in a high incidence state, they'll take 1,000. That'll be on the number of how many they think have Lyme. If you live in a low incidence state like the ones up above, they will count 140. 1 out of 50 is all they count. Lyme was found in Lyme, Connecticut. 39 children had juvenile arthritis, and I think there were 12 adults. And this Polly Murray, who was quite the go-getter, she would not take the physician's no for an answer. She kept saying, we got to find a cause, we got to find a cause. She went to Yale, and Dr. Steer listened to her. He came and interviewed patients, and he decided, I think it probably is ticks that occurred mostly in the summer and fall. So he recruited the Rocky Mountain team, and Dr. Willie Bergdorfer was the one who found that spirochete in the tick gut. It was a great accomplishment. Now, if you know that you have a tick, you have a rash, you get diagnosed. The trouble is some of the chronic patients, even back then, did not get well. So Polly Murray actually, along with Dr. Bergdorfer, the person who found the spirochete, tried to tell Dr. Steer and all the physicians, and they closed their mind to it. She was very frustrated. She said, you have to listen. You were one of the ones that listened to me. Why aren't you listening now? But they went on, and that actually started the Lyme War. I don't know if you ever heard that. I never heard that term. I'm finding out all these things after somebody in my family got sick. It's called the Lyme Wars, and it's vicious. It's vicious. They don't believe there's chronic Lyme. And so now I think that that's almost over because Dr. Steer and Datweiler, who's the one who invented the Western blot and the ELISA, they both now, I believe, know better. Dr. Steer and another denier were on a research by Lemo that took 6 years to find out what was the cause of the severe symptoms. They actually found there were 20 plasmids within that spirochete, and a lot of those were viruses. So I don't know how they did it. It's such a tiny little organism, but they did. Back whenever Polly was trying to get him to understand, Dr. Datweiler and Dr. Steer were interested in getting a vaccine. That was their focus. Unfortunately, because of the vaccine that they had that did come out and was actually taken, it did not stay in production. But because of that vaccine, they didn't want to include in the Western blot and the ELISA the OSPA, which is the outer surface protein A, or B, because they said now that would be a problem with that vaccine coming out. So they didn't include those. And it turns out those are some of the most virulent factors they found on this research they just did last year. So Polly Murray has actually written a book. It's on the left. And she talks about that history. Pamela Weintraub, who is a medical researcher, no, I'm sorry, she's a medical journalist. Her and her family got Lyme, and they were so sick and nobody would believe them. And she got into the middle of this Lyme wars, and ended up, saying, I used to think they were quacks, and now I know they're the only ones helping us. So those two books are very important for history. And when you see patients, it's important because, they've not been treated well. And it's, the medical establishment is so slow to understand what the new findings are. They're still on obsolete findings. So Tulane is someone that is working with Duke, Dr. Spector's group. So it was Duke, Tulane, and Hopkins working together. So Duke was getting the meds, trying to find out what would work for the targeted therapy. Tulane was doing the animal studies. This is a monkey study of the brains. And Hopkins was putting it into production and doing clinical studies. So this is spirochetes in the brain of monkeys that Monica Embers found, and it was actually published in 2012. Unfortunately, the prior study by Klempner was published in 2001 that said long-term antibiotics don't help. So there's those two camps, and like I say, they were very divergent. This is brain inflammation. It shows that every area of the brain is affected with long Lyme. That's actually been reproduced many, many times. Hopkins has online YouTubes talking about, I don't know why people are still saying chronic Lyme doesn't exist, because they have proof. There's a physician from Columbia. His name is Dr. Brian Fallon, who is a psychiatrist, and he's done a lot of work on the mood disorders with long Lyme disease. And this is a study they did in Denmark with some researchers there. Lyme patients have a 42% higher rate of affective disorders, such as depression, bipolar, and other. And they have a 75% higher rate of suicide. And this was Denmark, the whole population, 6.9 million. So I think it was just a paper study they got the information from. So we know from Dr. Fallon and others that there is something called PANS and PANDAS. PANDAS was the first one discovered, and it was by Dr. Susan Sweeto. She's the National Institute of Mental Health. And she found that 70% of OCD patients who had an infection before the OCD, so it was a little bit more limited of a population, but they had strep. When the strep was treated, they did well. She has a lot of online education on that. PANS is when Lyme is included in PANS because it's any infection. It can be influenza, it can be anything. So, and then a little bit broader, not about Lyme, but there was a study in Australia in 2023 that showed kids with cats have double the risk of schizophrenia, and they feel it's from their brains developing, and they don't know if it's a toxoplasma. But I will say the Bartonella that causes cat scratch fever is found in ticks. When I said that there's co-infections, Bartonella is one of them that's found in ticks. So there's two books that I know of. Dr. Scott Antoine and Nancy O'Hara have books on PANS and PANDAS. And they're very helpful because it's a comprehensive guide on treatment. Basically, the bottom line is you treat the infection first. And if the antibiotics don't work because it's been too long or they just don't work, IVIG is another treatment. And Dr. Antoine's daughter actually had a lot of psych symptoms. So he had taken her to his friends. He was an ER doctor. He took him to his friends, and everybody said, put her on a psych unit. It's definitely psych. His wife found out about PANDAS, and they had her tested, and she was found to have strep as the cause of her OCD. So he got a lot of parents together from the PANS and PANDAS groups, and they petitioned in, and they have to cover IVIG. It's a little bit of a problem because some of the pediatricians are going straight to IVIG when they shouldn't. But his book is very helpful on guidance. So the Lyme patients fight's making progress. As I mentioned, Alexandra Cohen, they owned the Buffalo Bills, her and her husband, Stephen, and she got Lyme, and it was the typical course of nobody diagnosing it. They have given about $80 million. So there's places all over the country, including Dr. Spector's group, that got a lot of money from that, and the Bay Area Lyme Society got a lot of money from that. So she's made a huge difference. And it's sad, it's the patients having to do it instead of the government money that's supposedly for tick-borne and zoonotic diseases. They really haven't done much at all. And this, I want to mention Olivia Goudreau, which I didn't really know much about her. I knew that there was a Live Lyme Foundation, but Live stands for Olivia. She was in 2nd grade. She was 8 years old when she got Lyme. She saw 51 doctors and had a chart so thick that nobody even wanted to see her. She said some of the doctors just said, no, this is beyond me, and sent her to another specialist. So her mom did not give up, and she was found to have Lyme, and she got treatment from a non-traditional physician, which is what happens a lot, because the regular physicians went down the line of chronic Lyme doesn't exist. And the non-traditional physicians, and there's definitely quacks there too, so I'm not saying they're all good. They are not. A lot of them are taking money from these poor patients, but there are good ones that are really trying to help the patients. And she went to one, so lots and lots of meds, and she's back to normal now. When she was 12 years old is when she started Live Lyme. She read about a son and his mother living in their car. They sold everything to get his medication. And ever since then, she's been a go-getter too. She helped get the TIC Act passed. Susan Collins, the senator, invited her to come, and she went around and talked to all the congressmen. She's 19 years old now, and she's done more than most any medical school in educating people. They have a day named after her in Colorado. She has a book. But she looks fine. From Lyme patient to advocate, or something like that. I think it's called from Lyme patient to activist, I guess it's called. There's pictures of her with the cast of Modern Family, Sarah Sandberg, Daryl Hall, who also had Lyme and was not diagnosed. So these are some people that actually passed away from Lyme, in addition to Dr. Neil Spector. So it's not just a intellectual enterprise. The first one was more on education too. She did Bartonella Babe Facebook, and she used acting skills and everything she could think of to try to get people educated. The second one had gone to Rhode Island for 3 weeks on a camping trip, and he had carditis. Of course, his Lyme test was negative because it's such a terrible test. And the third is from Canada. She had been a volunteer at homeless shelter and helping disabled kids. Chris Christopherson was somebody famous. He was first told he had fibromyalgia, he had all these muscle spasms, and they were golf ball-like and just so painful. And they put cortisone in him and did all these things. Then he was told he had idiopathic cardiomyopathy, and then he was told he had dementia. 4 years into the dementia, he started looking terrible. So his wife took him to a non-traditional physician who actually now works for the Amen Clinic, which is really a huge brain research. And they found he had Lyme. So his dementia has greatly improved, and he's been able to resume most of his life. And that isn't always the case. Sometimes when it's that far along, there's nothing they can do. And this research is by McCloskey, and her article was titled Alzheimer's as a Neuroborreliosis. It meets Hill's postulates and Coe's postulates. And I'm not finding hardly any follow-up after this. What she found was actual biofilm. She did not find the spirochetes, but she found the biofilm from these spirochetes. And the thinking is that it probably triggers the body to react with the plaques and the tangles. And as far as I know, nobody's following up on that. So hopefully they will. So to paraphrase Mark Twain, it isn't what we don't know that gets us into trouble. It's what we know for sure that just isn't so. Other people that are famous that have had are Shania Twain, Ellie Hilfiger, just a lot. You can look it up, and their stories are all the same, and they're all really sad. They couldn't get anyone to listen to them. And like I say, I didn't know until somebody in my family got sick. My sister's husband had been having fevers, and they kept testing him for COVID. He had shortness of breath. He had some symptoms, and he was sent to rheumatology, and his hand swelled up. He actually had to have surgery on one of his joints. And after we heard about another case, a teenage girl in our family that was found to have Lyme once her knee swelled up and she had a lot of trouble. We had him tested, and he was not really meeting the guidelines for the Lyme, but he had Babesia and he had Bartonella. The Lyme is very hard to meet. They require 5 bands, and it was from the CDC surveillance that they're requiring 5 bands. CDC repeatedly says that is not a diagnostic test, but as physicians, we don't have other guidance. So we use it as a diagnostic test. But anyway, he got treated for 6 weeks, or yeah, it was, I think, yeah, 6 weeks with antibiotics for Babesia, which is like malaria. It can cause anemia, and for Bartonella. And the infectious disease doctor, I wasn't sure if he would. I knew him from working at the hospital, and I was hoping he would treat him because he's against using very long-term antibiotics. But my brother-in-law's fingers, he had 5 fingers altogether that were swelled. The one he had surgery on, and the other 4 he was going to have surgery on. The swelling went down. He's off all immunosuppressants. He didn't have rheumatoid arthritis. He just like the kids that ended up in the wheelchair. He had complications of a tick-borne infection. So the spending at the top of this, it talks about Lyme, is $68 a patient. And HIV/AIDS, even though they have good tests and really good treatment now, is $82,000 per patient. And it probably is because we're helping other countries, and that's great, but they need to shift that money over because it's so common now. So as a psychologist, here's some tip-offs. Since you can't rely on the tests, you can suspect that it could be Lyme disease if you have physical symptoms and psychological symptoms. It's actually the psychologist that sent people back to their physician and said, I don't think this seems like a typical depression. It doesn't seem like a typical bipolar. But then the physician has them tested. They say it's negative, and they say, sorry, but it's probably psychological. So you look for is versus physical symptom, and look for if there's summer flu, especially if that flu doesn't get better, especially if that's the beginning of a downhill battle, and get them treated quickly and long enough. They used to get 1 dose of doxy, and I think that still happens, and that's inadequate. The early stage is when you catch it and prevent this terrible outcome. Look for other Lyme symptoms. Regression is big, especially with pandas, actually, the strep. Sensory sensitivity. The hearing and visual overload sometimes makes the kids too overwhelmed to be able to go to school. The fatigue, Olivia, that I told you about with Live Lyme, she said she couldn't even hold her head up sometimes. That's how fatigued they are. And I think it was Dr. Spector who said it's like taking double doses of Benadryl. It's just a terrible thing. Double vision actually, if you have somebody with encephalitis and they have vision problems, think of Lyme. Rage, and I think I mentioned the Bartonella. Bartonella is very associated with psychiatric, very associated. So if you check them physically, if they have skin stria that looks like pregnancy striae, then suspect it. And they can actually biopsy that and find the spirochetes in it. OCD, panic attacks that last a long time. Think of it maybe being from Lyme. Bipolar and schizophrenia I mentioned. I wish it was a cause of all that. I really do. And it isn't. But Dr. Susan Sweeto, the head of National Institute of Mental Health, she says a lot of our psychiatric is probably from infection. There's a couple groups about infection in the brain. There's one called Alzheimer's Pathobiome Group, and they're not getting funded very well yet. Hopefully they will. But we might find out that a lot of illness, they think Morgellons, the one where they have those skin things that come through their skin, could be spirochetes. And that one they said would be associated with H. pylori, I believe. So it's very complex. Even that pathobiome group says it's going to be really hard because you can't just treat the infection if there's a microbiome of the brain. And so it's going to be difficult with that biofilm and with some of the mechanisms they have from those 20 plasmids within the spirochete, they spit out antibiotics. That's why Dr. Spector's information is so good. He talks about a lot of these things. I want to end with a poem, and that's patient-oriented education that matters. And I feel that education needs to be prioritized much more than it is. I think it should emphasize the most deadly disabling diseases, the most misdiagnosed diseases, and the most costly diseases. And it's too easy to get caught up in minutia. So I'm going to encourage the curriculum committee and everyone that whenever they see the objectives, they think of this and they start making sure that we have more than 10 minutes on Lyme disease. Because it meets pretty much all three. In research, also the same thing. I think we need to prioritize the request for the proposals and funding. I don't know why NIH does research the way they do. They need to prioritize it into the most deadly disabling diseases, the most misdiagnosed diseases, and the most costly diseases. And I'll give you one example. I know a little boy who is deaf in one ear. He was not diagnosed timely. And so I thought, well, I'm going to look and see what NIH did about it. And I couldn't find anything, so I wrote to them, and they wrote back, and they didn't write back. The NINDS wrote back for the neuro and stroke unit, and they wrote back and they said, yes, we do that. You can look on Reporter, you can look on clinical trials. I looked on that, and there was an NINDS funding 3 times, one in 1997 and 2 more since then. And they were to the Institute on Deafness. And there was not one report of what they found. There was not one report of methods. So whatever funding they gave them was wasted. We did not advance science at all. So then I thought, well, I'm going to look up neuroborreliosis because this 14-year-old that we know, she was really great in school, straight A's, and she's now on a disability 504 plan. And actually is getting better. She's on antibiotics. But she has a couple co-infections and Lyme disease. It was found in her knee. So I looked up neuroborreliosis, and it's kind of the same thing from them. So I've written to them, and I said, the very least you should do is expect people to give a report on publicly funded research. So it's in the dark ages, and Dr. Spector was right. So that's my presentation. I know I went kind of fast. You'll have the slides you can look over, and I hope you found that as intriguing, awe-inspiring, and horrifying as what I did.